But wait, there's more. Our $100 trillion bipartisan betrayal. Like most out-of-control government programs, Medicare began with the best of intentions: to assist senior and retired citizens with medical expenses. There are different parts of Medicare, but only 3 of them have the potential to contribute to our economic downfall. Medicare Part A, which pays for hospital admissions and visits, Part B, which covers doctor visits, and Part D, which covers prescription drugs. Unfortunately, like Social Security, Medicare is nothing but a massive Ponzi scheme where the number of those who've been promised benefits greatly exceeds our ability to pay for them. Medicare Parts A and B have combined unfunded liabilities of $68 trillion. Despite knowing that Medicare was already hemorrhaging, politicians passed the Medicare Prescription Drug Improvement and Modernization Act in 2003, which authorized Medicare to cover prescription drug costs starting in 2006. In less than 3 years, that act, Medicare Part D, brought to you by the Republicans, has run up additional unfunded liabilities of $17.2 trillion. David Walker, the former Comptroller General of the United States, meaning he was formerly in charge of keeping our government's books, and that is a plural, called Medicare Part D probably the most fiscally irresponsible piece of legislation since the 1960s, because we promised way more than we can afford to keep. I think that Mr. Walker was being far too generous. It wasn't a fiscally irresponsible piece of legislation. It was a borderline criminally negligent one. There is no difference between our government spending money it doesn't have and someone on the street who runs up their credit cards with no intention of ever repaying them. Both are, at best, morally questionable, and at worst, guilty of theft. In this case, it's the theft of our freedom, prosperity, and sovereignty. For anyone keeping track, our politicians have committed future generations to pay a combined $99.2 trillion just for our unfunded Social Security and Medicare obligations. Add in our national debt and interest payments, and you'll easily exceed the capability of most calculators. What this means to you and your family is that irrespective of how responsible you've been in your purchases or how frugally you've lived in your life, your share of this $100 trillion will work out to be around $330,000. A family of 4 will be saddled with $1.3 million, again, excluding all of the other debt that we've already talked about. The good news is that the typical high school graduate will earn as much as $1.53 million over his lifespan, meaning that you may want to rethink your current family situation and have a few more kids. Remember, inverting the population pyramid of a Ponzi scheme is the only way out, although it is an idea that common sense should tell you would only delay the inevitable, since all of those children will also retire someday. Global warming experts will also chastise the idea because growing the human population is, of course, irresponsible. It is clear that neither the Democrats nor the Republicans, champions of Medicare Part D, really care anymore. They know that when all the bills come due, they'll either be living a comfortable retirement with the proceeds from a fully vested government pension and access to excellent medical care through their own federal health care plan, or they'll be dead. That's why they have no incentive to do the right thing, just the politically expedient one. It is also why we should seriously consider strict term limits on every politician. No, make that on every public servant, including bureaucrats, administrators, judges, and appointees. No more lifetime tenure for government employees. Maybe the more short-term we make their careers, the more they'll begin to think about the long term.